Hello again, friends. It's Jamar Doyle, President and CEO of CHSM, the Council for Health and Human Service Ministries of the United Church of Christ. I am so excited for this month's ministry moment because I am joined by the Reverend Donna Smith-Pupillo, who is the Executive Director of the Deaconess Nurse Ministry in the St. Louis region. Donna, thank you for joining us.
Oh, thank you for inviting me and allowing me to share our ministry.
And I'm so glad that you're here to talk about that because I had a chance to go to your website, learn more about Deaconess Nurse Ministry and what you all do. And there's a fantastic video on their website, friends. So go to their website, check it out. You'll have a link to it at the end of this video. But in that discussion and in that video, we kind of talked about some of the misconceptions about Deaconess Nurse Ministry and just sort of everyone thinking it's all about parish nursing, which is important, but you do so much more beyond parish nursing. So can you tell us a little bit about those misconceptions and who you are, what you really do, and the impact you're having in the greater St. Louis area?
Yeah, I'd love to share that. When Deaconess Nurse Ministry started, yes, it was originally all parish nurses, nurses connected to congregations across the St. Louis region. They did their work through churches and through the work of health and wholeness with a team, with their pastors, with the lay people in congregations. As time has gone on, we have changed and shifted. Um, we do still have parish nursing. We have one parish nurse in the Catholic tradition because we are ecumenical. Actually, we're interfaith, and we did have the shift where we are not as much parish nurses as we are community-based nurses. So we provide professional registered nurses to other faith-based organizations using that same kind of holistic model that parish nurses used, which was mind, body, spirit, and community. We still take those same tenets that we've always had in parish nursing, and now use that and apply that to food pantries, to soup kitchens, to affordable housing units, to independent senior facilities, to youth treatment centers, and community centers. And so we have nurses now embedded in those programs across the region, providing that kind of service, that relational-based holistic care to the people that are served by those organizations. A lot of misconceptions revolve around the fact that they think we are still in that parish, just in the community through congregations, but we're not. We're a much more broader service organization in the community. The other misconception that comes is that sometimes people think that we are still somehow connected with Deaconess Foundation. Indeed, we were, and we are Deaconess affiliated as far as we are founded by them. We were founded by Dick Ellebrick in the move to have the centennial celebration for the Deaconess Sisters back in 1989. Originally, we were Deaconess Parish Nurse Ministry. We were an LLC of Deaconess Foundation. But in 2014, when we made this shift, we became our own nonprofit. And in doing so, we broadened our scope of service, broadened who we were, and also became an independent 501c3. So we carry the Deaconess heritage in that's where we came from. That is where we originated from. We take that service model, because the Deaconess Sisters served in the community. We do take that service model with us, but we are no longer an LLC of the foundation. We are our own independent nonprofit serving the greater St. Louis region.
Thank you for sharing that and really clearing up some of those misconceptions about who the Deaconess Nurse Ministry is and how it relates to your founding, and that understanding that while you may have been founded as sort of a parish nurse organization back in '89, that there was an intentional sort of move in 2014 to broaden out and really focus more on community-based nursing and practices. So maybe you can tell us about that transition, what that's meant to the greater St. Louis community, and perhaps even a time where you said, this is it. This is why we do what we do. This is our mission in action.
Yeah, when we broadened our mission and started serving in food pantries, soup kitchens, senior affordable housing, those kind of arenas, we saw a move towards serving those who had limited or no access to healthcare, who struggled with health and wholeness in a variety of ways, were impacted by the social determinants of health, housing, transportation, jobs, all the issues that come down when you don't have funds, you don't have the ability to be able to care for yourself or your loved one. And so as we made this shift and move, we saw that our impact was greater on those who really needed to have a nurse, who really needed the service. So, for example, here in St. Louis, I'm just going to share in the last month and a half. This is just in the last month and a half. Um, um, we've had one nursing home, the largest nursing home in St. Louis, close suddenly. There's a lot of a backstory with it, but closed very suddenly on a Friday. 176 residents had to be moved abruptly with just the clothes on their back to other facilities. When that happened, because of our work with seniors, we do work in the community for the city of St. Louis to help low-income seniors who have limited abilities with being able to pay the utilities, rent, those kind of things. And we receive funds to be able to help them. So we can give them a grant of $250. We pay their bills for them, and we do case management. Well, we got called by the senior fund who helps support that and said, Donna, can you go and do some case management on these people who've now moved to another nursing home very suddenly, and they left all their clothes, left all their belongings in the nursing home. There's nothing that they don't have anything. They need help. And so I said, yes. So we visited the people. We got a list of things that they needed because they were only moved with the clothes on their back. And we got a list. The senior fund paid for clothes. We delivered clothes and items. I will never forget my delivery for one young woman who suffers from schizophrenia and suffers from mental retardation. She had been moved to a nursing home in Arnold. We got her mom connected. Her mom didn't know that she had been moved and where she was. We got her mom connected. And then we went ahead and she loved to draw and color. Now the senior fund paid for her to have her clothes, but I bought some markers and paper for her to color. And the smile on her face when she could color, that was worth all the visits that I did, just all of this. Also, in this past month and a half, we've had a senior affordable housing building, not one that we served, but in the city, had pipes burst, totally ruined apartments of these seniors. And they wound up getting placed temporarily at the airport Hilton at a hotel. And again, we got asked by the senior fund, could we go and do some case management, find out what these people needed, see where we could help them get placed, find out what we could do with them, and with a collection of other providers, including St. Andrews, who has housing and did a great job over at St. Andrews. So we did, and we were able to help them we were able to help try to navigate for them to be able to get the housing that they needed. We got called and asked if we could provide diapers and incontinence supplies. We delivered that to the hotel. And so just in our short time here in the last 2.5 months, the impact on now that some people say, well, that's not a lot of people, but you know what? It was extremely meaningful that when I met with the man who was on dialysis and needed an apartment, that we were able to connect him with St. Andrews and get him an apartment rather than living in a hotel. That we were able to provide supplies and able to help people navigate a system that sometimes is very confusing. I mean, I've had the older women say, I don't understand what I'm doing. Can you help me? I don't know what to do. Who do I call? And us helping do that. And that's what we provide. We help people navigate, help people have a companion and be able to speak to them about their health and wholeness, be able to deal with their medicine and get their medicine delivered, and be able to make a doctor's appointment for them because they don't know how to do that, or be able to get the supplies they need to care for themselves, and to be able to just be there emotionally for them. So we have seen that impact. This last year, we have served over 1,000 people throughout these situations. We do a collaborative program, and what I mean by that, we are embedded in other nonprofits, other faith-based nonprofits. So, for example, the nurses that are at Every Child's Hope are Deaconess nurses. The nurses at St. Vincent's Core Collective are Deaconess nurses. The nurses at the St. Andrews affordable housing units and at Cape Albion are Deaconess nurses. So we collaborate. I will never forget sitting at a CHSM meeting with Mike Brennan at Every Child's Hope, saying they needed a nursing and they didn't know what to do. And again, I don't know what to do. And I said, well, why don't you think about us doing the nursing? And then he said, that makes sense, because while I know how to take care of the kids emotionally and what to do for their mental health and do all those pieces, you would know how to do nursing. And maybe the best thing we could do is come together and you offer your gifts and you do the best you can for the people. And at the same time, I can do what I do best. And then that way, the kids and our families are served better. And that's how we look at it. Us working with other people and in those programs, we can help in the way that nobody else can. And the clients and people can be served more holistically and more completely and be able to do that. So that might be a long-winded answer for you.
No, that was absolutely perfect. And you know what? I thought, to myself, one, this is not scripted, as you all can see, but what a perfect sort of wrap up to our time that we've just shared in St. Louis, where our theme was collaboration as the gateway to innovation, and talking about how Deaconess nurses are embedded in the Core Collective and embedded in St. Andrews and Cape Albion, other CHSM members, embedded at Every Child's Hope. So the breadth of what you all are able to do, one, expanding the impact you have through those collaborations, but then also hearing the just visceral stories about, seniors that abruptly maybe have to move because of, a facility closes down or a pipe burst, and not thinking through, if perhaps folks may or may not have family members that are able to step in and help, and who cares for those individuals? And I can tell you just from that story, hearing that in part, it's the Deaconess Nurse Ministry, and that the institutions in St. Louis put their trust because of the work that you've already done. I heard you say they pick up the phone, call you all and say, can you help us in this situation? And so that speaks to the trust and the level of respect and that you have in that greater St. Louis area, and the impact that it means. I mean, just hearing you say it's a small number, but it's not. Again, like you said, to that person, it means so much to now have a companion that's helping them navigate these very challenging, perhaps life-changing situations, and to know that someone is there, they're listening with their heart, and they're helping them achieve, the best possible outcome and connecting it and doing it, rooted in faith. So I just applaud the work that you do. And one question I have is just, how did you get into this? I know that you're also a minister, you're also a nurse, and how did you find a way to combine all of that into this community setting? So what brought you to this?
Well, I have to say, I deeply believe it was a God calling, very much so.
Mhm.
Um, and I was doing at the time that I took this position in 2010. And at that point, it was Deaconess Parish Nurse Ministry, and I was just going to be doing the nurses on the parish nurse side. Um, when I saw the ad for that, I was doing two separate things. I was part-time pastor and part-time nurse. And I was looking for a way and asking God to help me find a way that I could combine them, that I could put them both together, kind of like both sides of my existence into in my authentic self together, so that I could be whole myself and offer that in my role, in what I was doing. And so lo and behold, along came Deaconess Parish Nurse Ministry. I accepted that call. What I didn't realize at the time, I have to say that I really didn't realize at the time I was going to be taking this entity and making it its own nonprofit. That was a stretching moment for me. And it's okay, because I think God stretched me to help me learn what I needed to learn and to make the organization what it is. I also really felt like God was stretching the organization in itself to say, look, there's a place in our world where people need you, and let's move to this place where people really need you, and you can touch them with the nurses who are also, I have to say, every one of my nurses has a call. It's not just me. It's not just me because I'm ordained. It's also my nurses. The nurses who are in working with our folks all are called to do what they do. Um, they do it with such a passion and a heart and a love for the people. I have a nurse named Debbie who says she loves her food pantries. She
Mhm.
loves the people she serves. Um, um, I have nurses who work at senior housing who say they love the people they serve. And I know that comes deep from in them, their call, just like it comes from me. I have to say, the feeling that being called to this helps us drive the mission, very much so, because we have a passion for that. And that's how I came to this. It was coming to this because I was searching for a way to give of myself. And I think also that's how my nurses are too. They come searching for a way to give of themselves, to use their skills and their abilities, and sometimes be stretched to serve the people of God here in the community.
Amen. Those God moments that bring your mission and your God-given purpose to life, but then also stretch you in ways that you never imagined were possible, to even be of more service to God and also to our fellow humankind. So, uh, amen for those God moments, and also answering the call, which is so important. As you were talking to, one of the things that popped in my mind, I was also wondering, what are some of the, do you see challenges that perhaps Deaconess Nurse Ministry faces, or challenges to being able to meet your mission? And, are there ways that perhaps those that are listening can either get involved or help overcome those challenges or connect with you? Maybe you could talk about that a little bit too.
Yeah, I think always with a nonprofit, the challenge is funding. Always, it always is. We are grant
Yeah.
funded, we are donor funded. It's always funding. But also, we are looking to continue to expand into various sites. If an organization is in the greater St. Louis region and is considering having a nurse, please, we would gladly do that. We serve on the Illinois side and the Missouri side. So we do Illinois South and Missouri Mid-South. We're always looking for that. We're always looking for um, more sites and more places that would be willing to go into a contractual agreement with that. Um, Matter of fact, we're in a kind of a contractual moment, working through contractual agreements with Hoyleton to be on the east side. But so we're always looking for that. And that's always a challenge too, because, you know, finding the right fit, sometimes people want you and they don't really want you embedded in their program. It has to be kind of, as I say, the right fit. You want us, and yes, we will serve your people, and yes, it fits our mission and your mission, and it goes together well, and that's the right fit. And then also, we're always looking for donations as far as even in-kind donations. You know, if somebody has diapers or pull-ups or any of those medical kind of things, we gladly take those. We keep those, and the nurses use them out. We gladly are doing that all the time, looking for those kind of things that we can do because like I just said, you know, we delivered a bunch of donated, and it was donated supplies we had gotten on adult diapers and adult pull-ups. So always looking for those donated, what I call medical kind of supplies that we can always use. So that is always the case as well, is things that we're going to need. The next challenge that will come up for the agency is that you know, I'm getting ready to retire by the end of the year, and we will be in search. So they're looking through organizations and agencies and a variety of people for someone who will come into my role, who's got a healthcare background and who has the heart for the mission, just has the heart for the mission. And that will be a challenge as we make a transition, going from me to another person. But I also believe God will send, you know, I think, you know, there's a call there, and we know that the call will happen, and that will come in that way. So that might be some of the challenges coming forth in the next year or so, and some needs that we have as well.
Amen. So you heard it here. If you are a a nurse or someone who is in this profession and feel a call after seeing this video, reach out. And if you're so moved to even just donate, give them a call. Again, look up their website. And actually, you know, I don't want to assume what is the best way to reach you if someone is just sort of, you know, led to reach out. Is it an email? Is it a phone call? What's the best way?
Best way I would say is probably an email.
Okay.
And you also can go on the website. We're www.faithnurses.org. We're also going through our email, and you can email either me directly, D Pupillo, Pupillo, my last name, at faithnurses.org, or the administrative office, which is adm@faithnurses.org. Either one of those emails will work. You can always call. It's a 314-395-4655. And so people can call if they want as well. But you know, we'll respond, and people can get a hold of us.
Great. So you heard it right from Donna. There are several ways, multiple ways to get in touch with Deaconess Nurse Ministries in the greater St. Louis area. The river is not a barrier. They do also look at Southern Illinois as well as the Missouri side. They're looking for folks that are willing to donate, maybe time or also donate materials, as you heard. Or if you have a passion for this ministry, reach out as well. Or if you're even an organization that perhaps is looking to partner and see if this is a right fit to have Deaconess Nurse partner with you, that is an option that I've heard as well. So, Donna, many opportunities for people to connect with you and hopefully
Yes.
sort of fill their need to serve while also expanding your mission. So, um, hopefully, this has ignited something in someone out there who's listening. Thank you so much for this time. Is there
Well,
anything
thank
else you want to
you.
share?
No, thank you so much for inviting me. And I look forward from hearing from folks, and I have to say I'm so grateful for the Council for Health and Human Service Ministries. When I came into this work, um, it was the Council for Health and Human Service Ministries that was instrumental and helped me learn my role and provided me with colleagues. And so I appreciate all my colleagues in Chisholm. um, I will, I'm forever grateful to them and to the council for everything they have done to help support me and Deaconess Nurse Ministry, and continue to support us. So I wanted to say thank you.
No, no worries. And you are always a member of the Council of Health and Human Service Ministries, even after retirement. So just appreciate your passion, your vision, and all that you have done for the greater St. Louis area and for Chisholm. Because as much as you may have received from Chisholm, even in my short time here, I have received so much just talking to you, learning from you, and being in community with you. So thank you for this time. Friends, thank you for joining us for this edition of Ministry Moments. It has been my joy to talk with the Reverend Donna Smith-Pupillo, who is the Executive Director of Deaconess Nurse Ministries in the greater St. Louis area. If you'd like to find out more information, there will be a QR code that will appear at the end of this. Scan it with your phone and you will be taken to our website. You'll also see the Find a Provider link where you can look up Deaconess Nurse Ministry or any other Chisholm agency that you may want to connect with. Thank you so much for this time. And just remember, God loves you no matter who you are and where you are. And so through that love, continue to serve. Thank you so much for your time, my friends. Thank you for being with us again today, Donna. And we will see you on the next edition of Ministry Moments. Take care.